The global rates for suicide have increased over the last decade, and according to the World Health Organization, there is one suicide death every 40 seconds. In Canada as well, suicide is a serious health and social concern, particularly for men. In fact, in 2009, almost 3,000 Canadian men died by suicide, and the numbers are rising, especially among men aged 50 to 54 and 85 years and older. It is interesting that while men have low rates of reported depression, suicide rates are at least 3 times higher in men than women. To better understand this discordant relationship, we undertook a series of research studies on men's masculinities, depression, and suicide. Part of a research-intensive research center at the University of British Columbia, our research team, Men's Health Research Program, led by Dr. John Olive and John Ogronichuk, have completed 3 studies with subgroups of men: college men, middle-aged men and their female partners, and older men. Research findings from all 3 research studies were published in peer-refereed journals and presented at numerous conferences and scientific meetings. But our overarching goal was to reach the public directly. So we've decided to make a knowledge translation website called Men's Depression, Help Yourself. What we did was to create a website that showcases our research findings in various formats that are more appealing to the public and speak to men with depression as well as their family. For this website, we've interviewed a range of men who experience depression, as well as healthcare providers who work with men with depression, and they shared their perspectives and experiences of men's depression and provided some advice for other men who suffer from depression. A total of 38 video clips were made to assist men who experience depression and their families, as well as guide healthcare providers and researchers better understand men's depression. Similar to the videos, we've invited co-authors from each of the articles drawn from the previous research to do a brief podcast to talk briefly about specific findings. Using the direct quotes from the participants from the previous research studies, we've created 3 interactive booklets that detail how men experience and manage their depression and suicidal thoughts. These booklets enable readers to click on certain icons that take them to corresponding videos, podcasts, or other online resources. Finally, to keep the conversation going, we've created a blog page inviting visitors to comment or share thoughts on our weekly blog posts. This website was launched on May 1st, 2013, and we are confident that it will benefit visitors to the site. Now, our next aim is to continue raising public awareness and knowledge about men's depression and suicide by designing, implementing, and formally evaluating a set of face-to-face and online and mobile suicide prevention resources and interventions that are tailored, targeted, and tested among young, middle-aged, and older men.